I'll be doing the recorded lecture for Chapter 8. We're going to be talking about therapeutic communication. Therapeutic relationships. And as we talk about therapeutic relationship, the next unit is going to be therapeutic communication. The concept centered to the nurse-patient relationship. Again, patient care is centered around the client and his family. Care should be given with high dignity and respect. Nurses should be sharing information to those who have the need to know. Information sharing should be confidential. Again, like I said, the center of the patient of care should be centered around the client and the family. Collaboration in policy and problem development is also part of patient-centered care, and we should give clear and appropriate boundaries as we provide client or patient-centered care. Therapeutic use, safe, confidential, reliable, and consistent information should be shared. Use personality consciously and full awareness. Attempt to establish readiness, structure the nursing intervention. So we got to make sure that we provide that care that is safe, that is confidential, and is reliable. And then again, we have to attempt to establish readiness. Is that client ready to learn? Okay, and then are we competent or ready to give them that information to help them learn as nurses? Then again, our interviews or interventions needs to be structured. Those interventions needs to meet the needs of the client. Important of talk therapy, advanced practice nurses based on psychopharmacology. Important talk about therapy to how it changes in the brain chemistry. It's the way of in chemistry immersed the way the same works the same way. I'm sorry. The changes in the brain chemistry works pretty much the same way as medication. Best treatment for most psychiatric problems would be a combination of medication and psychotherapy. So those clients could benefit from medicine and therapy. Okay. Goals and function. Goals and function. As we know, we have to facilitate communication of distressing thoughts and feelings. Assist those clients with problem solving. We have to help the patient examine self-defeating behaviors and test alternatives. Promote self-care awareness, self-care and independency. Provide education about the disorder and then any treatment for the most part. Okay. This is a case study where a 19-year-old has been admitted to the hospital for an episode of debilitating depression. Becky has bipolar and with the depression type. I was really, I was always hospitalized. I was already hospitalized for this last month. She said, "This is stupid and hopeless." Becky is withdrawn and preferred to lie on her bed when she must join others in the community room or for her first group therapy. She sits with her feet curled under her and stares out of the window. At times she seems to be holding back tears. At other times she looks happy. So let's look at her. Personal relationship. Initiate for the purpose of friendship, we know this. Socialization, enjoyment, and accomplishment of a task. Mutual needs must be met when we develop personal relationship. Communication, we can give advice, ask questions to help. And then content should be shared on that is superficial. Content of communication is superficial. Therapeutic relationship. Need for the patient identified and explored. We have to identify those needs and explore those. We again, I can't stress enough. We have to set clear boundaries. Problem-solving approaches must be taken. New coping skills developed, and then behavior changes should be encouraged during the therapeutic relationship. You're about to initiate your first contact with Becky. Which is the most suitable goal in establishing a therapeutic relationship with Becky, you think? Is it A, establish friendship and a sense of fun? Is it B, ensure that mutual needs will be met? Or is it C, establish clear boundaries while identifying patient needs? And then again, the last one is it to ensure two-way communication to give or ask for help. So I'm going to let you all talk about that in class tomorrow, and we'll determine the right answer. And then you have another, let's skip that one. Boundaries. When we talk about boundaries, we have to set boundaries. The expected and acceptable legal ethics and professional standards that separate nurses from the patient. We must provide a safe space for that client. So set your boundaries and stick to them. Overall involvement. Increase the risk of boundary crossing, boundary violation, professional sexual misconduct, blurring roles. So again, legal boundaries, patient right to confidentiality. Breach of confidentiality is a common law tort, which is a civil wrong. This wrong can result in lawsuits resulting in monetary value. Sexual misconduct. This also violates state standards. So again, we want to make sure that we know our roles and that we don't get over involved. So over involvement increases the risk of boundary crossing, boundary violation, professional and misconduct, and then blurring roles. Um, so when we talk about boundary crosses, this is when a relationship slips into professional conduct text, when a nurse and needs are met at the expense of the patient. So this is when you have some boundary crosses. The nurse needs are met at the expense of the patient. Then you have violation, where take advantages of the patient vulnerable. Nurses or healthcare providers may take advantage of the vulnerable population. Then you have professional sexual conduct. This is where there's a physical breach of conduct that may include expression of feeling and thought or gestures that are sexually or could reasonably be interpreted by the patient as a sexual. So again, you've got to set boundaries, okay? Because the patient could think that you're trying to, insinuate a relationship. So be careful with that. And then I kind of talked about transference and counter transference again, like I said. It's basically transference is when the nurse displaces her feelings on the patient displaces their feelings on the nurse, and then counter transference when the nurse unconsciously displaces his or her feelings on the client. So a little bit more about counter transference. Nurse again displays her feelings, or his or her feelings, related to the person that nurses pass on the patient. Patient transferences, the nurse often result in countertransference in the nurse. So basically, some common signs of countertransference in the nurse is over identification with the patient. So again, this nurse want to work basically solely with that one patient. So that's a red flag. Focus of self-awareness. Nurses' values and beliefs reflect on our own social values of cultures, our subcultures. Again, choose from a variety of influences and roles and responsibilities as well. As we move on, you notice that you forward to working look forward to talk to Becky because her dark sense of humor reminds you of your best friend in high school. You also began to make this cynical joke. hoping to have a good life together. What is the relationship showing early signs of? What do you think is showing early signs of? Would it not be counter-transference? It would. It would be. The nurse unconsciously displays feelings related to significant figures in the nurse's past onto the patient. So that's a good example there of counter-transference. Then based on Pavlov's model of nurse-patient relationship, he talks about the phases, the pre-orientation phase, and what goes on in this phase. You're preparing for the assignment. You're researching the patient history. You are recognizing your own feelings and thoughts, um, and you're also anticipating and setting goals and rules before the meeting. Before you get to this, you're preparing. This is a pre-orientation phase, and then the next phase you should be orientating. So you're in the orientation phase. So this is where you are going to establish rapport, parameters of the relationship, set parameters. Then you are going to initiate formal or informal contracts. Make sure your confidentiality is adhered to, and then termination of of terms. When you go there, you let the client know I'm only going to be here for X amount of days. So you don't want them to think that you're going to be there forever. So you want to that start actually the termination phase start in the pre orientation phase as well. Okay, and then the working phase, which maintains relationship, gather further data, promote the patient by helping with problem solving initiatives, self esteem, and also use of language. You may have to get an interpreter to help. What about that working phase? This is where you want to facilitate behavior change, overcome resistant behaviors, evaluate problems and goals, and you want to redefine them as necessary. Promote practice and expression as an alternate adaptive behavior. Okay? And then our next phase, I believe it's going to be our termination phase. Summarize the goals and objectives achieved. Discuss the ways that the patient, incorporate the new roles and coping strategies learned. Review your situation of the relationship, and you want to exchange memories. Again, this is the termination phase. These are some factors that could promote patient growth. Genuineness. You got to be genuine. You got to show the client that you're genuine. Empathy, not sympathy. Got to show empathy, not sympathy. Positive rewards, like attitudes. You want to your actions, and then attendant. Attendant is a special kind of listing that refers to an intensity of presence of being with the past. At this time, simply being with another person during a painful time can make a difference. So attending, okay? Good eye contact, body postures, or nonverbal behavior that reflects the degree of attending and are highly culturally influenced. Okay? Superseding value judgment helps the patient develop resources. These are other factors that help promote growth. This is patient after your first conversation. Becky withdrew from you again because you're evenly ready you because before you even get ready to begin, which statement will constitute most to establishing Becky trust? Will it be, weren't you complying with your medication regimen? It must be discouraging to be readmitted to the hospital so soon. Everyone with bipolar disorders end up in the hospital occasionally. You must take your drugs as prescribed or you will be rehospitalized. So what do you think here? Let's battle that out, okay? Another case study. Becky tells you I have something secret to tell you, but you can't tell anyone else. The nurse agrees. What is the legal likely consequences of the nurse action? Is it healthy feelings of sympathy by the nurse for the toward the client, blurred boundaries in the nurse-client relationship, improved rapport between the nurse and the client, enhanced trust between the nurse and the client? And I was gonna give you, it's gonna be very, very blurred. It just depends on what it is. I might not be able to tell it. What be your best response? Excuse me for yawning. A nurse spends an extra time with a client who has personality features similar to the nurse's estranged spouse. Which aspect of countertransference is most likely to result here? Will it be over involvement, misuse of honesty, indifference, or rescue? Gonna let you battle that one out. Also, we'll talk about it in class. Alrighty. As Becky is preparing for discharge, she presents you with a handmade card of appreciation for the care you provided. Should you accept the card? Yes, you can. The meaning of the card needs to be examined. If a card is inexpensive and give the at the end of the hospital with the relationship has developed, the nurse should graciously accept. So they can, you can take card showing they will, the client is just showing his or her appreciation. This ends the chapter 8 lecture, and I'm going to save it, export it, and I'll upload it in the class.